Hey, what's up, everybody? Welcome back to another episode of Health Made Easy. This is your host, Dr. Jason Jones. And today, and really this entire series, because you guys know we like to do a series of podcasts on here so we can chunk down complex, more detailed health information into snapshots that are a lot easier to absorb and a lot easier to understand when we take the material and we chunk it down over the course of a podcast, as opposed to doing this really long one where we have to try to remember all these different things. And this month is really going to be a deep dive into a topic that we've covered somewhat before, but maybe not to the degree that we're going to do it this month, and that is going to be inflammation. Now, inflammation is tied to causes, inversely or indirectly causes many health problems, everything from heart disease to cancer to you name it. Inflammation, there's an inflammatory component, at least, to those problems. And what we're going to do today is we're going to talk about some of the more common blood tests that you can have for inflammation. And for some of these, they're not particularly thought of as tests for inflammation, but they can be a really good window into how inflamed your body actually might be. And when we talk about inflammation as we go this month, we're not talking about where you sprain your ankle, and it swells up, or you twist your knee and it swells up, or you whack your finger with a hammer and it swells up. That's a different kind of inflammation. We're talking more about systemic inflammation in this month's podcast. So we see a lot of people in our office every single week with chronic inflammation, and most cases of internal inflammation are often associated with high levels of stress, lack of proper nutrition, and chronic diseases such as heart disease, digestive problems, and other more complicated ones like cancer. And inflammation has also been implicated in many autoimmune diseases, and the immune system is triggered and triggers an inflammatory response that attacks the body like it's an enemy. So the question is, how do you detect these silent forms of inflammation in specific targets, as well as monitor their progress? And one of the best approaches is the use of blood tests. So we're going to talk about some blood tests and some markers that are used to determine or detect chronic forms of inflammation. And the first one is one of my favorite ones, but it's more thought of in terms of blood sugar, and that's a hemoglobin A1c, or what most people would call just their A1c. And this is a blood test that measures the amount of glucose in the blood over the past 3 months, so basically like a trailing 90 days of what your blood sugar looks like. And it's a major test to look at a person's inflammation level. The result is often recorded in a percentage or just a particular number, and the higher the number, the higher the level of blood glucose. And the hemoglobin A1c is often used on people who are diabetic to detect diabetes as well, but also to monitor blood sugar levels. And a high A1c means that there is a high blood glucose, and this can cause a lot of damage to our internal organs. The other thing is that as we look at the A1c, depending on who you listen to, because oftentimes with blood tests, there's like these moving numbers that happen in there. So, we want to be in that sort of 5 or 6 range. And if you're below a 5, you're doing awesome. Okay. The next one is going to be fasting insulin. So fasting insulin is another blood test for inflammation. The insulin hormone is produced in the pancreas, and it helps the cells get glucose from the blood. So these hormones are often released when the body detects a rise in blood sugar. And the body needs constant circulation of insulin, but when it becomes too high or too low, it becomes a problem. And an excess amount of insulin in the body can be a sign of insulin resistance, which means that our body does not respond well to insulin, thereby making it more and that it increases the risk of inflammation in the body. Next one is serum ferritin. So serum ferritin is a blood test that measures the amount of ferritin, or essentially blood cell protein that stores iron, in the body. When you have a low level of ferritin, it indicates that you are deficient in iron, and that can certainly lead to things like anemia. Now, a high level of ferritin, on the other hand, can indicate inflammation, liver disease, autoimmune disease, chronic infection, and some types of cancer. Serum ferritin decreases or increases based on inflammation, making it a useful marker for detecting chronic diseases. Next one is C-reactive protein, or what's called CRP. C-reactive protein is a protein in the liver that increases when inflammation increases and decreases when inflammation decreases. This test is useful in diagnosing and monitoring chronic inflammatory diseases, including things like arthritis, inflammatory bowel disease, autoimmune diseases, and even some psychological issues. Now, RDW, or red blood cell width, is another one. This test measures the difference in the size of the red blood cells, and it's an excellent way to detect inflammation and oxidative stress. Now, red blood cells usually start out large, but they decrease in width as they mature, because they only last about 120 days. So how large the cells are will determine how much nutrient and oxygen they can actually deliver. So basically, an elevated RDW is linked with many diseases such as macrocytic anemia and cardiovascular events. So I hope this helped you. I hope this gave you a little bit better of an idea. And what I wanted to do with these tests was, and there's tons of tests that you can do out there, but these are some of the really simple ones that your general practitioner can order for you and add to basic blood panels, and they are not that much cost-wise to you to actually add them on there. And sometimes you can get them done in your yearly blood work. So I hope this helped. If it did, do me a favor, share this podcast with someone, share that with someone who is suffering, who is hurting, who wants to better understand inflammation and actually how to get rid of it, because we're going to talk about that on some future podcasts. We'll see you guys on the next one. See you later. Bye-bye.